Hi, I'm Dr. Radtke, and I'm an allergist at Dreyer Medical Clinic. Today, I'm going to go over the 3 things that I think everyone needs to know about allergies. The first topic is over-the-counter medications and how they're not all the same. Most of the patients that I see have tried at least one over-the-counter medication or another, but not everybody understands the differences between these. The over-the-counter antihistamines, like Zyrtec, Benadryl, or Claritin, do a nice job for mild allergies, sneezing, itching, that sort of thing, but they don't do much for congestion. Also, they can make a person drowsy. The decongestants like Sudafed or the D part in medicines like Allergy do a nice job for congestion, but they don't do much for sneezing, itching, and the like. Also, the decongestants can raise a person's blood pressure. The over-the-counter nasal sprays and eye drops have to be used with caution, because if a person uses them for more than 3 days, the nose or the eyes can become dependent on these medicines. That leads to terrible rebound symptoms when the medicine wears off. That doesn't happen though with the prescription eye drops or the prescription nose sprays. My favorite over-the-counter remedy by far are the nasal saline irrigations. These are based on the old Eastern tradition of neti pots. The idea is you rinse out the sinuses with salt water. They do take a few tries before you get the hang of it, but most people, if they're doing it right, find that these therapies are surprisingly comfortable and effective. The next topic I want to cover is allergy testing. Now, the best way to treat an allergy is to avoid the thing that a person has an allergy to in the first place. And the only way you can do that is if you've had testing. Currently, there are only 2 scientifically proven ways to do allergy testing in clinic. Number 1 is skin testing. Number 2 is a blood test called serum-specific IgE. Now, the blood test isn't bad, and it's a good option for people who are too sick to do skin testing or who don't have an allergist nearby. But the skin test is considered better. It's more sensitive, meaning it may find allergies that the blood test would miss. Depending on those results, your doctor will talk with you about specific avoidance measures like dust mite covers or mold remediation, specifically tailored to whatever your sensitivities are. The final thing I want to go over are allergy shots. Now, the most powerful tool at an allergist's disposal, next to avoidance, is allergen immunotherapy, also known as allergy shots. The idea here is to make the body less sensitive to the things that a person has an allergy to. It's a slow process, but a very effective one. It's usually broken up into 2 pieces. There's a build-up phase, where a person's getting shots 1 to 2 times a week, getting to a target dose, and then a monthly maintenance phase where the person's getting that target dose once a month. Typically, people are on shots from 3 to 5 years, but whatever benefit they get tends to stay with them for many years after they're done. Newer therapies, called oral immunotherapy, where a person gets a pill in the mouth or maybe drops under the tongue instead of an injection, are still under investigation. These are not approved by the FDA or approved by national experts for use in clinics as of 2013. Now, shots do have a risk of causing life-threatening allergic reactions, although thankfully those are rare. But it's critical that shots are only given in an environment where there's a provider who's well-trained and knowledgeable about these kind of reactions, knows how to treat them, and knows how to adjust shots accordingly. But when done right, shots can make a big difference in a person's life. I hope this has been helpful in answering some questions you have about allergies. Feel free to visit our website, Facebook page, or our Twitter feed if you have more questions. Thanks.